So I get to interview Jason Han from InBody. This is Lexi from Yoo Direct Health, and we are at the clinical application of longevity medicine. So InBody is one of the biggest tools that we see currently in longevity medicine. Talk to us a little bit about how the technology works specifically for longevity practices and some of the key metrics that we want to track.
The InBody is designed to be a validation tool for all the great work and services that you're offering to these patients. Right? We want the patients to walk away with a deeper understanding of maybe what's been holding them back and the direction that they need to go. And we want to empower the providers with the tools and resources to be able to help their patients out as best as possible. And so a few key metrics that we speak on, obviously muscle mass and fat mass, but diving a little bit deeper, thinking about visceral fat, talking about inflammation, talking about even hydration status, and the impact that that has on metabolic health, metabolic function, and cellular health as well. I feel like that's what's moving the needle for a lot of longevity practitioners using the InBody device.
So one of the biggest booms to happen in peptide world right now is going to be the rise of the GLP-1s and GLPs with GIPs, and then hopefully the triple agonists here soon. One of the key markers that I think most longevity practitioners would all agree on is muscle is the currency of aging. And so can you talk a little bit about how you differentiate or how a practitioner would look at the difference between lean body mass and skeletal muscle mass?
When you take a look at the InBody device and isolating skeletal muscle and lean body mass, we essentially want to give you a breakdown of, number one, how do we isolate the proper amount of muscle mass necessary to know what's going to go into contributing positively to metabolic function, right? And that's going to be lean body mass, right? The lean body mass, especially when you think about longevity, obviously it makes an impact on your metabolic function, but as the patients get older in age, using that to hedge against the risk of things like frailty, right? Fall risk assessment. All of these are tools that the providers have to educate the patients on how they can help them out not just today, but in the later years as well.
Yeah. So what I personally like about using the InBody in our practice is I tell our patients it's a 45-second test that will give us such a good jumping off point. I always say you can't change what you don't track. And so there are some prep stipulations that I think are really important that a lot of practitioners don't realize. So can you talk us through how to get a good, accurate assessment when we're doing InBody, especially when it comes to women's health, because I think that is something, as someone who takes care of a lot of perimenopause, menopausal patients, they need to know.
So just like with any diagnostics, there are ideal testing conditions and parameters. We recommend trying not to eat 3 hours prior to an InBody scan, or not doing an InBody scan immediately after, let's say, a workout.
Right.
But it's also really difficult to manually check off all of those conditions for every patient every single time. The generalized recommendation that's been working for a lot of my clients is having the patients test at relatively the same time every day. People have routines and lifestyles, and so that's going to guarantee consistency. That way you can use the first test as a true baseline.
Yes, absolutely. One of the common things or common questions I get for females is menstrual cycle. And so I actually recommend women should not get tested when they're on their menstrual cycle because of the shift in fluid, which can be very disheartening when women are on their cycles and they're maybe holding on to a little bit more fluid. But truly, that's why InBody is so important, because it does give us a good breakdown analysis of all those different pieces. Mm-hmm. So I purchased an InBody, I think it was 2018. And so the first InBody I ever purchased was the 570. Mm-hmm. And I would say that one's like my tried and true. However, that was discontinued.
That is
true. And so talk us through why was that one discontinued, and then kind of what is maybe the next model that would be a good comparison.
Yeah, I mean, that InBody 570 you had, great buy. It was our best seller before it was discontinued, but we had to make way for some of the technological advancements that we've made. And so, for example, with the new 580 platform, a couple of the improvements that we've made is we've improved the precision for visceral fat by 100 times.
Wow.
We know how important visceral fat is to longevity and to patients, and so we wanted providers to have more precision in assessing visceral fat change even on a weekly basis.
Yeah.
But also the ability to track things like inflammation or edema in specific body parts. How do GLP-1s contribute to inflammatory reduction? How can we track edema reduction? But also adding another layer, I think a lot of practitioners are also offering services like IV therapy.
Yes.
And one pitfall of the IV therapy industry, for the most part, is the subjectiveness or vagueness post-IV to be able to quantify improvement in hydration.
Sure.
With that 580, you can now actually show the patients pre-IV to post-IV exactly how much their hydration's been improved. Because a lot of people are dehydrated, they just don't know it.
Absolutely. Mm-hmm. And I know that Leonard talks all about hydration, and there's hydration within the cell and out of the cell. And this is where a product like iCell water can be super helpful as far as really getting into that intracellular matrix. Another question. So as you know, we have two InBodies.
Yes,
we
we
also
do.
have the 790?
770.
770. So that one is, I say that one's like the Cadillac of InBodies. And so we talk about phase angle. So can you help us differentiate the difference between a visceral fat score and the phase angle?
So visceral fat is going to be more of a biomarker for your cardiovascular health, right? Especially around all the case studies surrounding the use of, let's say, GLP-1s and how they help cut the risk of heart disease. Visceral fat will be important there, but phase angle is going to be more of a biomarker that's going to gauge your cell membrane integrity or your cellular health data. So people in the longevity medicine space, I feel like, throw around the phrases biological versus chronological age or body age. And again, circling back to how subjective it is, there's so many ways to get there. Phase angle gives you an objective measure to gauge how healthy the patient's cells are. And so a patient on a bioidentical hormone replacement therapy program will probably show positive reactions or improvements in their phase angle prior to seeing substantial changes to their body composition. And so if you think about what the InBody can measure and all the data it can capture, phase angle would be the most granular layer of insight into the patient's health.
Yeah, no, absolutely. It's one of those tools that you don't realize how cool it is until you start doing it more often. You're like, wow, that actually got better. One of the big things that we do in our practice is hormone optimization. And so as women go through menopause, estrogen declines, which causes women to be more insulin resistant and will also cause a rise in adipose tissue, as adipose tissue can also create estrogen. And so one of the cool things that we see is once we get a baseline and we start tracking hormone optimization, seeing that phase angle and even that visceral fat score improve, as well as if we're optimizing with testosterone, the rise of lean body mass. So if practitioners are interested in bringing on an InBody, can you talk us through like what's a typical cadence of how often should they test?
For most of my clients, monthly is the sweet spot. What we want to avoid is if you're testing on a weekly basis, let's say a cheat meal here and there, causing trends to not show a clear linear progression, right? And so typically a month to quarterly is usually where my clients find is suitable without it being too long where they lose engagement or it's too far out where they can't really pivot quickly to keep patients on track. That's where I think the monthly cadence fits for most clients.
Yeah. I think one of the other common questions we get is, well, should I just get a DEXA scan? And, you know, I think about availability, cost, and what is actually doable for the patient. You know, I know that there's some great longevity practices that do have DEXA machines. We're not one of them. But again, we have InBody, and I think it's a great tool. And I think doing DEXA scans can be extremely helpful. But what I like is the ability for most practitioners to have access to tools. And so can you differentiate maybe the results of like the 770 to a DEXA scan?
We actually launched a newer model a few years ago called the InBody 970. That's going to be a little bit more comparable to a DEXA. So it's our newest flagship device. When you think about DEXA as the gold standard in body composition, our InBody technology has been validated to pretty much a 99% correlation rate to DEXA. However, one of the limitations that we had was not being able to use bioimpedance to assess bone health, right? And so with the InBody 970, you can actually now get insight into bone mineral content using the linear progression or maintenance of bone mineral content alongside the maintenance of skeletal muscle mass to indicate whether a DEXA scan is even necessary or not, right? Because for a lot of patients who have to drive to another clinic, sit in another waiting room, and pay out of pocket for DEXAs, to be able to be offered that service in-house has been a huge win for the patients and the providers as well.
Absolutely. So we talked about what is the best testing parameters. Who should not get an InBody? Are there any? I know that there are contraindications. So what would those be?
Yeah, it's pretty much just patients with pacemakers. Just with our core technology being centered around bioimpedance and the potential risk factors for patients with pacemakers. Outside of that, perfectly safe we do work with pediatrics, we do work with geriatrics, OBGYN, perimenopausal. So as long as you don't have a pacemaker, you'll be safe to test on the InBody device.
A common question we get is pregnancy and breastfeeding. And so, unfortunately, because of the hormone shifts, fluid fluctuations, it's just you're not going to get the most accurate results. So even though that's probably not a direct contraindication like a pacemaker would be, I probably wouldn't recommend doing it when you're in those two states of condition.
Sure.
For sure. So what is like the next technology that InBody is working on?
Yeah, that's a great question. So we actually just recently launched what's called our InGrip device. And so it's an accessory that is compatible with the InBody. We do all this work measuring muscle, measuring fat. The next layer to our consideration was, how do we find the utility or quality of that muscle?
Right.
And with the correlation between hand grip strength and longevity, we wanted providers to get some insight into what that muscle mass is going to look like and what it can do for them in the coming years, especially with the boom in GLP-1s.
Right.
A lot of providers, the battle now becomes preserving muscle mass in
Absolutely.
patients. And so what are the risk factors for getting patients on certain medications and in certain programs? That's what that InGrip device is shedding some light on for us.
Yeah, that's super exciting. So let's say, someone's listening to this and they're maybe not a patient at a longevity practice, but they do want to get an InBody. What would be the best way for someone to find a location to get an InBody test?
Yeah, so we just recently moved all of our testing locations from our website to the InBody app. That is so that anybody who even is using our InBody consumer products can find out a professional, a provider near them who can provide a more comprehensive InBody report and a consultation to understand the results and ultimately educate the patients on what they can do to find success as far as getting healthy.
So if a practitioner has purchased an InBody, what would you recommend is the best way for them to learn how to interpret it for their patients to make clinical recommendations?
So we've spent a ton of time and resources in developing our onboarding program and our training platform. So we have what's called InBody Academy, which is our online training platform, but we also have an entire team dedicated to development and training as well. Mm-hmm. So for all of our InBody clients, if you feel like you're not maximizing your InBody, please reach out to us. We'll set up training for you so that you can get the most out of your investment and ultimately help your patients out as best as possible.
I think one of the most undervalued tools that I've seen, and I've learned a lot of it from patients, is the app. So can you talk us through a little bit about what are the cool features that maybe patients or consumers would be interested in for tracking their data?
The InBody app is a personalized app for each end user, right? And so when the InBody scan is done, let's say in a provider's clinic, you can send the results from the unit straight to the patient app, which will then start compiling test history. As the app compiles history, it'll start making some generalized recommendations for patients,
Right.
give them some insight into where their health currently is and what they can do to improve maybe certain deficiencies. But the app is also great in fostering engagement and motivating and keeping the patients, I think, set on their goals.
Another, I think, important insight as a practitioner is, let's say you started with the 570 and you want to upgrade to the 970. 970. Can you talk a little bit about the merge process? Because I know that that's possible and that we've had to merge some of our InBody data and what that looks like.
We have a cloud software called InBody Web, right? And InBody Web is pretty much the digital landscape where all of the patient data can be housed for each provider. And that way, if you upgrade your device from an older generation to a newer model, you can still cross-reference all of the old patient data. That's where the InBody Web Cloud software comes into place.
So another question that we get from patients is, well, can I just buy one of those at-home scales? And so how would a practitioner, very maybe educational wise, explain the difference between InBody and just a body composition scale that they can get off of Amazon?
It's going to really boil down to the accuracy of the device and the reliability, right? A scale can spit out a number, but there's no guarantee that that's accurate.
Right.
And what you're purchasing with InBody is, I think, the peace of mind in knowing that the data for every scan is going to be accurate or not. If you know that you need to get from point A to point B, you can probably get there on a bicycle, but you can probably get there on a car, right? And so what's the most optimal way to get there in the most efficient way as possible? And that's what the InBody is going to be able to provide. And so for those home scales, there's limitations to what they're actually measuring versus what's being plugged in via empirical estimations. Whereas one of the 4 pillars of our InBody technology is that we don't use any empirical data to skew the patient results. And if that's important for you as a provider and knowing that the data you're seeing is actually unique to each patient, that's where the InBody makes more sense than some of those alternative options.
Yeah. One of my favorite things to look at on the InBody results sheet is the bottom chart where it tracks the trend over time. And in our practice, we always tell patients, there's 2 things that help with fat loss, body percentage fat loss. Is the more muscle mass you have does, and the less fat mass you have. And there's 2 things that are anabolic to muscle and catabolic to fat: testosterone and growth hormone secretagogues. So in many of our longevity practices, we're optimizing both. And so one of the coolest, I would say, metrics that to chart is to see how the graph goes up here and it goes down here.
Right.
So can you talk a little bit about the differentiators between maybe your lowest model and your highest model on the InBody of how that would look differently?
On the graphs itself?
Yes, on the graphs.
Yeah. On some of our newer models, you now have the option to customize that history section at the bottom. So for a lot of providers, we were tracking on the older reports weight, skeletal muscle mass, body fat percentage, and then the extracellular water to total body water ratio, which is how we indicate inflammation or edema. However, with our newer upgrades, like let's say to the 580 platform, you can now add visceral fat there.
Yeah.
You can now add basal metabolic rate. So you can take a look at what outputs really move the needles for my clinic and my patients and customize that history section as needed.
So if we had like the 570, is that an option to upgrade the customization, or is it only on their newer
It's
models?
unfortunately only going to be on a newer model.
Okay. So on the 790, is that also an option to
No,
customize it?
unfortunately
Okay,
not.
so
Yeah, so it's gonna be,
on the newer
versions,
models. Okay.
correct. Mhm.
That is actually quite fascinating. So if practitioners are interested in purchasing an InBody, what's the best way to go about doing that?
Yeah, they can submit an inquiry on our website at inbody.com. And they can also reach out to, let's say, their local InBody testing location and see where they got their InBody device. But the easiest way would be to reach out to us directly via inquiry form on our website.
Do you find that these machines require often calibration, a lot of maintenance?
I think one of the beauties of the InBody is how easy it is to maintain, and you've probably
Yes,
experienced
yeah.
it yourself. Essentially, the care instructions are just turn the device off at the end of the day, back on in the morning, allows it to recalibrate automatically, wipe it down periodically, right? There's some sweat and oil buildup with the patients being barefoot on it, and that's pretty much it. I don't know if you knew this, but all of our devices are handmade from start to finish by one technician or engineer. And on the back of every InBody device, somebody's name is stamped at the bottom.
Really? I did not know that.
That's a
I did
testament
not
to how
know
much
that.
pride and
Yeah,
ownership we take in
yeah.
every single device, and it's also part of the reason why these devices last so long and are so durable.
Yeah. So I will say, as I've had this InBody for the last 8 years, and I think of one time that we've had to actually send it back to get maintenance. But the nice thing is, it was very easy to work with, and then not only that, you guys sent us like a loaner.
That's correct.
So we weren't losing revenue, we weren't losing business, we weren't losing opportunity to track InBodies, which was great. That thing is heavy, though. I'm not going to lie. The box that came to send it was like putting a Christmas tree back in the box.
That's
it's just,
true.
It's just
We've
a
heard
lot.
that.
Can you talk a little bit about, I get to go to a lot of clinics and I have, people shadow me, and we use the wipes. Can you talk us, why is it important to use those wipes before someone gets an InBody test?
Yeah, that's a great question. So obviously sanitation is a big part of it, but like I mentioned, there's oil, sweat buildup, right, as people are on the electrodes with their bare hands and bare feet.
Right.
So there's actually a chemical component in those wipes that helps pick up the electroconductivity. Remember, our core technology being bioimpedance, it's frequency-based, and so it just helps create, a smooth connection from that skin to electrode contact.
Well, this has been great. We're so excited to continue to work with you and InBody. And if practitioners are interested in bringing on a new longevity tool, definitely InBody would be a great addition to any longevity program.
Of course. Appreciate your time today, Lexi. I mean, you're a titan giant into space, so it's great to be able to sit down and speak to you about all the great stuff that you're doing.
Yeah,
Thanks for having me.
Thank you.